right, welcome back to the Goals.com podcast, where we dive into what truly drives sales performance at the highest levels. Today's guest has built a remarkable career helping medical and biotech founders master the art of sales, even before they've built a sales team. Cathy Henry is the founder of Primetime Sellers, a Dallas-based consulting firm that helps early-stage healthcare companies develop their go-to-market strategies, tell compelling stories, and close their first big deals. With over 26 years in sales and marketing, including leadership roles at and Becton Dickinson, Cathy knows what it takes to turn innovation into revenue. Today, we're going to unpack how she helps founders sell smarter, navigate trade shows, and build the kind of sales confidence that drives growth from day one. Cathy, welcome to the show.
Thank you. I'm happy to be here.
You've worked for some of the biggest names in the industry, and Becton Dickinson, and now advise startups. What lessons from those early corporate sales experiences have carried over into your consulting work today?
Yes. Well, I'm very grateful for my time at 3M and BD. I received exceptional sales training and I worked for incredible sales leaders. And those experiences gave me a deep understanding of how sales and marketing work when there are large budgets and strong infrastructures in place. So today, that perspective helps me bridge both worlds because I can map out what an ideal plan would look like with unlimited resources, then design a version that's lean and creative and achievable for a startup.
I love that. You often say founders need to master sales before they have a sales team. What are the biggest mistakes you see early stage founders make when trying to sell their own products?
Okay, yes. So the first thing I talk about is a mindset shift. A lot of founders that I work with fall into two groups. Some are natural salespeople without even realizing it, and others are totally intimidated by the idea of selling. And I get it. They are microbiologists and engineers and clinicians. They are not career salespeople. So when a founder says to me, I'm not a salesperson, I smile and say, guess what? You are now. And stop telling yourself you're not. Because whether you like it or not, no one can sell your vision better than you can. As far as mistakes, I think some of the biggest mistakes I see is that founders will lead with features instead of problem solving. And their technology is new and exciting, and they've poured years of their lives into it. But sales isn't about what it does, it's about the problem it solves. So I work with them to get clear on who their customer is, what their pain points are, and how their product meaningfully addresses those. And last, I will say, I see sometimes founders will use their investor deck as their sales deck. And so I work to make sure that they understand those are two different audiences, and what is important to an investor is not going to resonate with the buyer. So yeah, I'd say those are some of the things I see with early founders in sales.
All great stuff. You help healthcare startups translate complex clinical or technical data into compelling selling stories. What's your process for doing that? And why is storytelling so critical in medical sales?
Yes, so my background is in public relations, and that has shaped how I approach sales quite a bit because PR is all about shaping stories. So when I'm working with a startup that has complex clinical data, I treat it like a journalist would. I start with the basics. What is the who, what, when, where, and why of this story? And then that is what helps me shape it so that we are telling a story and not just reciting statistics. And I'll also say if the data is particularly clinical, I try to make it as visual as possible. I once had a product I sold that affected biofilms, and I actually used one of my son's toys in my sales meetings because it perfectly mimicked the structure of biofilms. And it cost $10 on Amazon, but it got the point across instantly. And I will also say I practice complex data presentations over and over and over so that I'm comfortable telling the story because I can't expect the customer to be comfortable and buy from the story if I'm not comfortable delivering it.
That makes sense. Trade shows are a big focus in your programs. What separates the startups that make a real impact at trade shows from those that just show up and hand out flyers?
Yes. Okay. So startups that stand out at trade shows come in with a strategy and not just a booth. They have a real goal. So even if it's just brand awareness or they want to establish partnerships or get some pilot leads, they have a plan and then they measure the ROI from that. The ones who treat it like a field trip and not a funnel aren't going to get the same results out of it. You've got to rehearse your message and know who you want to meet and talk to, and then follow up like a pro. I always say, I'm a big fan of trade shows, but they're a big investment of time and money, and you cannot wing it. And the other thing I will say, if you've ever done a trade show, they are long days. You are talking constantly, there's very little downtime. But a lot of really important networking happens even outside of the exhibitor hall. So I talk to my clients all the time about, I know we're tired, but we're going to go hang out at the hotel bar and we're going to strike up conversations with people in the elevator because you never know who you're standing next to. I was actually just at a trade show Monday and with a client, and there was a group that we'd been reaching out to for a couple of months that we're interested in seeking a partnership with, and we had not been able to get a response. They were exhibiting 2 tables down from us. So during the first break, we were able to go over, introduce ourselves, make the connection, and we are going to be partnering with them. And I kind of slapped my client's arm and I was like, that's why we go to these things. You have to be here.
I love that. When you start working with a new client, what's the first thing you look for to assess whether their go to market strategy is on the right track?
Okay, so what I look for with a new startup is alignment between the problem that they are solving and the person actually paying for it. So if the buyer and the user and the influencer aren't clearly defined, I feel like the go to market is already a little shaky. So I spend a lot of time with founders clarifying those roles. And I ask questions like who feels the pain? Who controls the budget? And who influences the decision. And once we get that into an alignment, everything else as far as sales messaging, the funnel, potential partnerships, those start to naturally fall into place from there.
You also coach founders on funding readiness. How can sales traction or customer validation influence investor confidence? And what do investors really look for in early sales efforts?
Yes, that's a great question. So, when it comes to funding readiness, investors are really looking for 2 things: traction and scalability. So, traction proves your product has real demand, and scalability shows you understand why it's working and that you can repeat it. So, having a few pilot sites or paid trials secured or signed letters of intent, those can make a huge difference because it'll tell an investor you're not just guessing, you're testing, learning, and refining. And I also feel like those early customer interactions are gold because they don't just validate your product, they really start to shape. They give you all sorts of anecdotal data that you can start using to shape your sales narrative and your investor pitch. So, all of that goes to just showing real world validation, which is what an investor needs to start to see that it's a business that they can trust to grow.
I agree. Healthcare sales are notoriously complex, with multiple stakeholders, long cycles, and regulatory hurdles. What advice do you give founders for navigating that landscape efficiently?
Okay, well, I actually have an entire workshop on navigating hospitals because the healthcare buying process is unlike any other industry. The first thing I tell founders is if it feels long and complicated, it doesn't mean you're doing anything wrong. That's just how it works. And there are so many moving parts. You have clinical champions, you have value analysis committees, group purchasing organizations, distributors, vendor credentialing, and half of that's even before you get on the hospital floor. So it can be overwhelming. So I focus on simplifying the process without oversimplifying. And I also talk a lot about maneuvering through a hospital. Having a clear sales message is critical because oftentimes in healthcare, you're not the one doing the actual selling, your champion is. So if you're lucky enough to have secured a clinical champion, whether it's a nurse director or a department head who believes in your product, they have to advocate for it internally. So we have to make sure the sales messaging is simple and repeatable and tailored specifically to that customer so that they can effectively sell your product for you when you're not even in the room.
Many founders aren't natural salespeople. We alluded to this earlier. How do you help them build the confidence and mindset needed to sell effectively?
Yes, so I remind founders that selling isn't about being charismatic. I mean, that certainly helps, but it's really about being clear and consistent. Confidence doesn't come from personality, it comes from preparation. So once you have a message that feels authentic and you've practiced it enough that it becomes second nature, you stop selling at that point and you're just sharing. And I can always kind of see the moment when that happens for them. And they'll even say something like, "That was fun." I'm like, yes, sales is fun. You just have to get over some of those kind of misconceptions about what sales is and just understand that it's about owning your message and just comfortably and confidently sharing it.
Who made the shift from leading in large organizations to advising lean, fast moving startups? What has surprised you most about that transition?
I will say it was very humbling at first. I definitely underestimated the weight that comes with those big company names and the access they provide. You want to test your sales skills, try selling something in a hospital with zero brand recognition and new technology that no one's ever seen or fully understands yet. That'll teach you really fast. So I've been surprised by just how scrappy and creative startups have to be. And it's such a weird trade-off. In corporate settings, you have structure and resources, but you have all this red tape. And with startups, you have speed and freedom, but almost no margin for error. But I will say, I've always had an entrepreneurial spirit, so I love the wide open space of startup work. I love moving fast and building momentum and putting deals together without watching them die in months of approvals. So I love the fast pace and it can really be exhilarating.
Goals.com, we always talk about what drives performance. So I'll ask you, what keeps you motivated and focused in such a fast moving, ever evolving sales environment?
Love that question because every great salesperson needs a strong why. It can't just be about commissions or quotas because there's so many factors that are outside of your control. So you have to ask yourself, what else gets me up and out there every day? And for me, my why has always been about the patient or the clinician. My sister has lived with a chronic illness her entire life, and I often picture her in my sales conversations. The technology that makes her daily life better today started as startups at some point. And that reminds me that what we do in sales can have a real impact. And in some ways, we can even be patient advocates. And I've called on nurses my entire career. So if a product or company makes their life easier, I'm all in. And it's also something I remind founders of. If sales makes you uncomfortable, focus on service. You have the opportunity to change someone's quality of life. So focus on that to push you through the fear of selling.
Cathy, was such an insightful conversation. Thank you for sharing your wisdom and experience with us. For those listening, if you're an early stage founder looking to sharpen your sales strategy or make your next trade show a turning point, definitely check out Primetime Sellers and connect with Cathy on LinkedIn. Thanks again for tuning into the Goals.com podcast, where we uncover what drives sales performance at the highest levels. If you enjoyed this episode, be sure to subscribe, share it with your team, and stay tuned for more conversations that will help you level up your sales game. Cathy, again, thank you so much for being here.
This episode is brought to you by Goals.com, the sales performance platform built to help teams stay focused, motivated, and on track. While most CRMs just track data, Goals.com drives real results. It's simple, affordable, and designed to help your sales team hit targets faster, without the headache of complex setup or costly consultants. Whether you're using a CRM or not, Goals.com works seamlessly to elevate your performance. Book a fun, fast demo today at Goals.com.